Good Friday, everyone. I'd like to talk about pharmacy law today. Um, a lot of patients and some pharmacists confused about pharmacy law every day, especially um, retail pharmacists uh, and people who work um, at the gym, CVS, Walgreens, Walmart. Um, they face with the pharmacy law every day. So I would like to talk some important pharmacy laws that may be benefits for both patients and pharmacists folks. So I would like to talk about Schedule 2 to 4 controlled substance prescriptions. Schedule 2 uh, is different with Schedule 3 and Schedule 4 and Schedule 5 and the prescription only. So the Schedule 2, like oxycodone, um, you know, hydrocodone, morphine, uh, those medications, controlled substance, Schedule 2 or C2 prescription. So first, I would like to discuss about day supply. Okay, so excuse me. So the day supply of C2 prescription, um, the maximum day supply for the C2 prescription is 30 days. But for some C2 medication, the maximum day supply can be 60 days, like for those medication for the dextroamphetamine or methylphenidate for the ADHD. So those medication um, can be 60 days supply. And some injectable infusion medication during the bumps, um, they may be okay for 90 days supply. So for these day supply limit is a different and vary state to state. So may need to check with your state law to see what are they supply limits for the Schedule 2 prescription. And the Schedule 2 prescription cannot be refilled. It's prohibited. So no refilling for Schedule 2 prescription. For some reason, prescription for Schedule 2 might be partial fill because they don't have enough medication in stock, so they are out of stock medication, and in that case, the pharmacist may give you some partial fill, but it's very complicated to do the partial fill You know, pharmacists need to um, dispense the rest within 72 hours, and if after 72 hours the patient not come back for the remaining, then the pharmacist must report to the prescriber, the doctor who prescribes the medication. This little, it has some uh, a complication if something happened after the partial fill. Um, and then it not permitted the patient request, so the patient cannot request a partial fill. Uh, the partial fill only occur if the pharmacy uh, did not have enough medication in stock. So how long the prescription, the Schedule 2 prescription is valid? Depend on state. Some state, uh, it set the time limit like 30 days limit. After 30 days, uh, the prescription is no longer valid. So um, you may need to get a new prescription for C2 medication if you cannot fill medication within 30 days. But for some medication, for some patients, like patients in long-term care facility, like a nursing home patient, or patient with a diagnosis of terminal illness, and the prescription may be valid up to 60 days from the day of issuance. So um, for the patient, the prescription can be filled within 60 days from the day the prescription was issued. So this is very important numbers and informations when you have the prescription for Schedule 2 controlled substances. You need to know some basic information to avoid, the prescription become invalid, and make sure you get enough medication, the total quantity, prescribed instead of a partial fill. If you uh, don't get a partial fill within 72 hours, then you cannot get the rest of the medication. And remember to fill the medication within 30 days. No refills permitted. Um, and then understand the state laws to make sure, if you have the prescription for dextroamphetamine or methylphenidate for the ADHD, and some injectable infusion bombs, the medication for infusion, then you need to, make sure you fill the medication within the time limits. All right, if you have any question, please let me know in the comment below. I'm going to talk a little bit about Schedule 3 and 4 prescription. So Schedule 3 and 4 prescription. There you go. Schedule 3 and 4 prescription. So again, the day supply, for state law, some state law is the maximum 30-day supply per single filling, or be spent at one time. Federal law say maximum 34-day supply per single filling. But only a 5 refill and 6 months. You only have 5 refills within 6 months from the day of issuance of the prescriptions. So after 6 months, you cannot fill the Schedule 3 and Schedule 4 prescription. Make sure you know the time limit. And only fill 30 days supply or 34-day supply per single filling. Okay, so as long as you have enough for medication for 6 months, if you have 34-day supply, then probably you don't have 5 refills, maybe 4 refills. So it might be we need to do some calculation of 6 months is equal 24. Probably you have 4 refills if 34-day supply. For box refill, yeah, if the pharmacist unable to supply the prescribed quantity due to out of stock or the patient request, so it's different with the Schedule 2 or C2 prescription. C2 prescription, the patient cannot request a box refill. Okay, and then for state law, you might not exceed 30 days supply, and the total quantity prescribed. And then after 6 months from the day of the prescription issue, you cannot do a partial fill or any refill, nothing after 6 months. May be valid for up to 6 months from the days the prescription issued. So these very basic but important information all patients and pharmacists should know to avoid any arguments when the time that the patient needs medication but cannot be filled, or too soon to refill, things like that. Generally, when the schedule maybe only 2 days earlier. Uh, if the patient want to get the prescription too early, they only do 2 days. Most of the schedule. All right, so this is some pharmacy laws that it occurs every day, and then some a lot of patients they don't understand this why the pharmacist refuse to refill the medication too early, or why they cannot fill the prescription even though they have some refill remaining like that. And the pharmacist, the healthcare insurance might have some information. For example, if you fill the prescription multiple pharmacy, your insurance may let the pharmacist know that you already fill this medication from the other pharmacy. So the pharmacist will know if you already got the medication for the pharmacy. Right? If you have any question or concern about this pharmacy law, please let me know in the comment below. Thank you for listening. Oh, I'm going to continue some very important pharmacy law. This is just for patient information. Good to know this information when you have a prescription, get it filled at the pharmacy. So the last time I talked about Schedule 2, Schedule 3, and Schedule 4 controlled substances prescriptions. Now Schedule 5 controlled substance prescriptions, or C5 prescriptions. Again, you need to understand that day supply on the prescription. So no federal or state law regulating the quantity of this prescription, C5 prescription, or Schedule 5 controlled substance prescription. So no law saying how many they supply, maybe anything filling any content. For the refill, no specific or set time limitation. So for the C5 prescription, the law doesn't say how many days supply can be refilled. It's not like C free and C prescription. It's limited to 30-day supplies. So, but many states, may limit refills of C5 prescription by refills within a 6-month period. It's like C3 and C4. C3 and C4 it limits to 5 refills within 6-month period. So it depends on where you live. Your state may want